Next, we have our panel discussion comprising of Carl Lingen, Jeremy Johnson Miller, and Amy Conrick. Carl serves as the Executive Director for the Iowa Public Transit Association. For the past 6 years, Carl has helped shape legislative policy for members, increased awareness and marketing strategies for public transit systems in Iowa. Jeremy is the Communications Manager at the National Aging and Disability Transportation Center. Jeremy manages social media and e-news publications and provides training and group facilitation for transit agencies and state DOTs for ESEAL's Project Action Consulting. Amy is the Director of National Projects at the Community Transportation Association of America, where she works on community support and business development. She also serves as the Director of the National Center for Mobility Management. Each panelist will have a little bit of time for themselves before we transition into a discussion. So Carl, we'll start with you.
Yeah, and I appreciate that. Welcome, everyone. Very exciting morning with some of our speaker discussions. And I know each of our panelists here today will just kind of highlight a few things, and that's what I'm going to do as well. I'm going to go through these pretty quick, but just want to highlight just a few things if we could advance the slides. First, just to know, the state of Iowa is very unique in the fact that we're one of the few states where we actually have coverage for public transit, at least somewhat mandated, or coverage in every single county. That is very rare. If you look at Missouri, Nebraska, they actually have more transit agencies and far less coverage. In fact, Nebraska probably has half their state covered with public transit. And now that those comprise of 16 regional systems and a total of 35 systems in total with them. As we talked about this whole morning, public transit is so critical. 1 in 16 households depend on it. If you add up all of our connections, our stakeholder engagements, individuals in the education, healthcare sector, you'll see that we have over 350 million connections in the past 5 years due to public transit. If you look at what we serve here in the state, it's really dealing with individuals, making sure that they are independent. We have a great ability to make sure we have good community access. We are transporting students. We are, of course, making sure we're delivering on those essential medical trips, and of course, keeping seniors, persons with disabilities, independent. And so what I'd like to just kind of go right into is just highlight just a few things that have happened for our state with public transit dealing with the pandemic. When everything happened back in mid-2020, we saw about a 50 to 75% decline in those months of, your April, May, and June, where we just saw almost a drop-off in ridership. We only had one transit system that closed down. But with that, our systems still had to operate, still had that overhead, and now had to pivot and get the PPE, new cleaning guidelines, really had to separate passengers, get masks, so forth. So it was very detrimental, but we were able to keep running. We've been running the whole time, continue to be safe, and really focused on making sure we're meeting those essential trips, especially those medical trips. And as you saw just from over year, we had about 20% decrease overall. So, from fiscal year 20 to fiscal year 19, we're seeing that 20% drop, which is pretty big. And we're kind of looking out the future. How do we entertain and get participants back? What are the resources for that? And we'll talk about that. What's kind of been unique is we'll talk a lot about partnerships, and part of our discussion here is resources. What was unique is some of the creative ways some of our systems, including HIRTA, was involved with helping food banks be able to transport groceries, food to individuals who maybe couldn't get out and have that capacity. So we were partnering with a lot of different stakeholders. Another picture there with Earl Public Transit up in northern Iowa doing the same thing. So we found ways to not only get individuals transport to the things they needed to, but again, worked with our community stakeholders to see how ways we could help. Another kind of resource and relationship and partnership that was kind of built is, again, NTS is a nonprofit organization working with the county, kind of near Linn County, serving a bunch of different counties, but really providing those workforce rides for after hours, especially for those essential workers. And also, along with our other public transit association or systems, really focusing on making sure we're getting vaccine appointments, getting individuals to those vaccines and moving forward. So you're seeing a little bit of that scope kind of increase with what our public transit systems are doing. And a little bit of the challenges that we're kind of seeing, just to kind of preface and set the stage here a little bit. But unfortunately, you know, with public transit, everyone thinks it's free, but in reality, if you kind of look at our gap and our need, the need is kind of how much money we need. That's represents about $150 million to get our bus replacement entailed. Right now, I believe we have about, what I want to say, if you want to advance a slide here, I believe it's about 53% of our current fleet is beyond its useful life. So you kind of look at that gap, that's that orange part. The little blue section at the very bottom, that's how much funding we will usually receive through state and federal grants or awards every year. You can see the big disperse, I would say, difference that we have with what our need is and what the funding currently is at. But as we're going to talk about a little bit today, what are some of the barriers with public transit? Let's just highlight again, it's a major reason why workforce retention issues exist. We did another project with the Department of Education where we found out childcare and transportation were the top 2 reasons why adults don't go back to get their HISET or similar GRE, or go back to get additional education, either through certification or not. It's what helps keep individuals out of the ER, and of course works on community livability. But with that, as we continue on here, I just want to talk about, and this is just a great graph that we had with one of our meetings last year, and it comes from the Boston Institute. And if you kind of look at this thing, the great part is how much individuals below the percentile. So you got individuals in the 35 percentile or below, even the 25 percentile of poverty. And kind of you kind of diverse what they're spending their money on. You'll see that owning an automobile is just as expensive for some of these individuals as what they pay per month for their housing and lodging needs, for their rent. And if you really think about that, that is huge. And you kind of even go up, you see that it really doesn't change until you start kind of get up to that 35% quartile of the federal poverty line or higher. That's dramatic. Think about if we could have good, reliable public transportation, what that gray part could do in disposable income and income to increase for a better place to live, education, other resources, better food. So if we can continue on a little bit, we are fortunately disincentivizing people to get public transportation because we built a model that shows that you have to really own a car. And really the cost for car ownership keeps going up, impacts congestion, impacts our communities. And more importantly, if you really think about it, we talked about a lot of inclusion here this morning, but think about your own employment practices. Every time I see something, whether it's any type of skill, I always see this: must have reliable transportation, AKA code, must have a car. Really, that's what they're meaning. Instead, I would rather see organizations, and we'll talk about this in a panel discussion, where maybe they offer, hey, reliable transportation is a critical thing. We are located near a great bus stop, and our company offers free bus passes for those who choose to utilize that program. Think about what that mentality does for those, again, who do not have reliable transportation. And if you really think about it, it's how most companies, employers, really kind of think about this. It's an economic development issue. It's something we need to think about, that not everyone has reliable transportation. If you advance, there's a company, warehouse in kind of central Iowa, near, I would say, the Council Bluffs area, that did Menards, had a huge warehouse, and they have worked with our public transit agency to basically work with individuals now into 3 different shifts to basically try to provide reliable transportation from communities all over, small towns all over, just because that's how low employment is affecting them. But it was the #1 issue for retention for this organization. And they knew that going into that. And by having a great relationship with the county, with stakeholders, nonprofits, as along with the Public Transit Association, they were able to get reliable transportation that was actually advertised in their employment with that. And it became a huge boom for them to make sure they could meet their personnel requirements. If you continue on, the only thing I just kind of want to highlight, and we'll talk a little bit more, is what does the future hold? I think we'll have each kind of panelists talk about that. But for us, for public transit, we are going to have to work on marketing. It's going to be just like the airline industry has to go through. We are going to be working on a marketing campaign called the Public Transit Gets Us There campaign. And it's really going to be focused on alerting, educating the general public, stakeholders, groups, legislators, the effectiveness of public transit and the resources for that. And what we really have to do is really show that it's safe, it's efficacious, it's efficient to ride public transit once again. And so that's just a little bit of overview of just some stats with Iowa and kind of how we're looking at this on a kind of a statewide basis here, and what some of those challenges and what we're going to be looking forward to. I'll kind of turn it over to our other panelist here.
Okay, I don't know where Danny went.
Danny,
are you there?
Can you pull up Jeremy's slides, please?
There we go.
Hi, and welcome. I am Jeremy Johnson Miller with the National Aging and Disability Transportation Center. Very happy to be here. I've only been away from the Iowa transit scene for a little bit, so I do miss some of those faces and names in the crowd. But today I'll be talking a little bit about community outreach and some of those efforts. Next slide, please. First, I wanted to just do an overview, since we do have 2 TA centers in the crowd today. TA centers are funded and recognized by the Federal Transit Administration, or the FTA. I am with the Aging and Disability Transportation Center. Also is the Center for Applied Transit Technology. Oh, can we go back? Applied technology, they focus more on autonomous vehicles and technologies that would be needed for transportation. The National Center for Mobility Management, which Amy is a representative of today. The National Rural Transit Assistance Program, or RTAP. They provide a wide range of technical assistance on anything that's impacted by transportation, and a lot of different types of trainings as well. And then lastly, the Shared Use Mobility Center. They do a lot of bike shares, scooter shares, Uber Lyft technologies, stuff like that. So just wanted to do a quick overview of that. Next slide, please. So who are we at the National Aging and Disability Transportation Center? As mentioned, we are federally recognized, but we are funded through a cooperative agreement with Easter Seals, the National Association of Area Agencies on Aging, or M4A, and also the Federal Transit Administration. So we have a little bit of a unique perspective there, but next. Our overall mission is to promote the availability and accessibility of transportation options for older adults, people with disabilities, their caregivers, and the communities. I won't dwell too much on this, but we do want to serve the professionals in the transportation industry, empower those communities, provide resources, and support the users. We provide primarily technical assistance, so anybody can contact us. We do have an 800 number or through email. We have a lot of information and referral services across the country where we can provide that technical assistance. We do quite a bit of training and presentations. We've started doing a lot of lunch and learns. We'll do virtual office hours where we'll have a selected panel member speaking on specific topics. That's been a really good receptive way of connecting with people throughout this virtual world that we're living in. We do have our own grant that we do fund. We'll have a new grant cycle coming out this fall, but then we provide that technical assistance on the grants. Today, I will be sort of touching on what sort of comes next in this post-COVID world that we're living in. I know we all know that it's definitely not business as usual. We definitely need to be flexible. But I think this might be a really good time to think about something new. Transit systems have learned that maybe smaller vehicles are the better way to go rather than driving the large buses throughout these rural communities. And what does that look like for future? Maybe even developing new branding or logos or reformulating your mission. Just because things are changing, I think this is a really good time to sort of move forward with that. But can we go back just one? But always, I do have to say, always evaluate your performance. As we move into this future time, what we were doing before COVID is probably not what we're going to be doing after COVID. Your long-range planning objectives may be changing. Your business plans or your strategic plans or your marketing plans may be changing. You may have to do things differently. But always reevaluate everything that you're doing, including those policies. Do they reflect what you're doing now? And I think those who are doing annual reviews would appreciate that. If your policies have changed, but your policy handbook has not, I think that would be good to look at those and see what you're currently doing and how those are reflected in your policies. Next, please. So moving more into that outreach and making those changes, always be thinking about who is your champion. Who in the community is your champion? Who can you call on if you're making changes, if you're trying to promote something new? But also, is your agency leadership on board? Is your board on board? Are they reflective of that change? Are they supporting that change? I think if you're making those big changes, you'll want those champions and really carry them through. But also considering this COVID period, has your coalitions or advisory groups continued to meet? Are you continuing that communication throughout this period? Are you really thinking about what's coming next or having that constant communication with your partners? But also, what can you learn from those partners? What are your partners doing? And what do your shared clients need? Maybe you're doing something that your community partner doesn't know about. I think that's really good to have that communication and think about who's doing what and how you can cross train your agencies. But also be thinking about, is the client comfortable re-engaging with your system? Are they comfortable getting back on the bus? Are they comfortable going back to their work sites or something like that? But it's in that communication of what's expected when they arrive to your bus. Do they know that the bus driver is going to be behind a plexiglass shield? Do they know that? That might be a little jarring for some of your riders. So constantly be thinking about what your riders need. But think about too, what ways are you communicating with them before they get to your system? Are they accessing your information with social media? Are they accessing your information with your website, with any apps that you might have? Do they have print materials that are maybe a couple of years old? Do those need to be updated as well to get that information out to the community? And as mentioned, just keeping them in the loop of what you're doing and what's changed in the community, and what you're doing to serve them, keep them safe, any cleaning regimens, but also sharing with those providers that you're bringing them to, just to let them know that what's happening in your area. I did want to promote this option that we do have on our website. It's called Every Rides Count, or Every Ride Counts. It is a sort of a build your own campaign. It's customizable, and it can be used with any application or ideas that you want. You can put all of your information into that. It has marketing and social media templates and infographics that you can use. I do believe it's in English and Spanish currently, but you can use those to your own desire. There are flyers, there are different formats there, but I wanted to put that out there. So if you have different formats that you wanted to use and promote your new changes or your services, you can definitely use those. That's already out there for use. Next slide. So at NADTC, we also have a unique perspective or opportunity that we can use, especially at Easter Seals. It's called Easter Seals Project Action Consulting. And it's sort of a way that we can do different trainings or speaking engagements and do different projects that are not under the purview of the FTA. And we can do different contracting with different state DOTs and different transit agencies to really do that one-on-one training opportunity and facilitation. And we do actually oversee 2 certificate programs, Travel Training Administration and Paratransit Manager Training as well. Next slide. And so one of our bigger programs that we do quite a bit of is the Accessible Transportation Community Initiative, or ATSI for short. And HIRTA was one of the recipients of the ATSI process that we've gone through. And it's really an approach for a diverse group to come together and talk about some of those urgent needs within the area. We really work together to create a clear vision, and by the end you'll have this action plan where coalition members can really work together and think about what's next for that coalition and what ways can you build your table together. Next, please. And so, like I mentioned, HIRTA just recently went through this. We actually had our 3 meetings a couple weeks ago. So I really wanted to highlight some of those action items that came out of that. And they're going to start looking at increased transit options for hours and days, but also looking at those different mode types of alternatives to the big buses that are driving around, maybe sedans or vans. How to develop inclusive marketing for maybe seniors and disability advocates. Educating the public on how to use transportation. That sort of rose up in all of our conversations of how do you ride the bus, how do you access that information. Long distance trips, cross-county trips are usually pretty essential for work or healthcare appointments, and so that came to the top as well. But also, how can we enact same day or more on-demand transportation options and make that more of an immediate, reliable source for the 7 counties that HIRTA provides. So just quickly, I wanted to throw that out there, that I know that HIRTA is actively working on that. So kudos to them to thinking about what's coming next. And then I believe Amy is coming up next, and so we'll have her present, and then we can take some questions as well.
All right, thank you, Jeremy.
Great. Good afternoon, everybody. Danny and Julia, thank you very much. It's so good to see you again. Thank you for having me here. My name is Amy Conrick. I know some of you, not all of you. I wear 2 hats. Basically, my home organization is the Community Transportation Association of America, CTAA. You may know us. We're a membership organization. We have over 1,000 members between transportation providers and our affiliate members. And also the director, as Jeremy has mentioned, of the National Center for Mobility Management, one of those FTA centers. So I'm going to, again, not have very many slides. One of the things I did want to talk about, go ahead, Danny, it's good, is the national perspective on setting, whoa, there we go, that this is really a time of unprecedented challenges and opportunities. One of the images I always like to bring up is the Chinese character. You may have heard this. Chinese character for crisis is actually composed of 2 different characters: danger, the character for danger, and the character for opportunity. And I think that's very apropos to where we are today. So that's kind of like the lens I would like you to think about as I go through these couple slides here. Okay, next slide, please. Thank you. So challenges, what are those challenges within the crisis in which we're in right now? Certainly, as both Carl and Jeremy have talked about, there's uncertainty among passengers and transit staff. Do I get vaccinated? How can I get to be vaccinated? Is it safe to get on transit? Do I have to get vaccinated? Something we're hearing from some transit staff. And what happens if I don't get vaccinated? Then there's those funding worries. Normally, our fares kind of chug along at, 8 to 10% fare box recovery rate. And we count on those federal grants, and we count on that local share. But now that 3-legged stool is really quite wobbly, and we're not so sure what we can count on going forward. So that's definitely a change. And will they return? Will we see empty buses, or will our passengers return? Again, a challenge that we are facing right now. And that kind of ties into that last bullet, the perception of public transit going forward. There are a lot of forces that are working kind of to make this very questionable, as to it kind of interferes with our ability to kind of put forward the perception that we would like. So if you think about it, there's telework. Telework's, everybody says that telework's here to stay for long term. I know we're teleworking in my office. We are starting to go into the office 1 day a week. I do use transit to get there, the metro system in DC. But we're even talking about we're going to have a 3-day week, 2 days at home. And what does that do to transit? So, but the other thing that we have seen, of course, is that those people who don't have an option, those must-use users, are the ones who are continuing to use transit, did so going all through the pandemic. So there's always this balance between creating transit for those who have to use it and creating transit for what we've called the choice riders. So what is that perception going to be going forward? And then looking at the opportunities, the one thing I want to ask is your new BFFs. We have seen all sorts of really exciting examples that we're going to talk about in the panel discussion after this, in terms of new partnerships being formed. And I have a whole list of examples, but again, I'll wait because we can talk about that in our discussion. But hang on to those BFFs. They're incredibly important. The opportunity piece of COVID has been to develop relationships with agencies who might not have paid a lot of attention before. And if there are human agencies out there in the audience, you also may have been looking at your transit system in a completely different light. Funding levels. So again, even though those funding levels are 3-legged stool is pretty rocky, We now have a new challenge. Over the 3 legislative acts that have been passed since COVID, the CARES Act, what's known as the HIRTA, which I couldn't tell you what it stands for, but the Supplemental Act, and then also the latest, the American Rescue Plan. Across those 3 funding programs, public transit has received $70 billion, with a B, $70 billion. Incredible, multiple times more than what we would get in our normal formula grants. But all of this is within the context of reauthorization of the FAST Act now coming due by the end of September. So some in Congress are looking at that $70 billion and say, we gave you a ton of money. And how do we know how that's going to impact what they feel like providing within the reauthorization? In addition, there's the infrastructure bill. We don't really have a sense of what that looks like yet. But again, how is that going to interplay with your authorization? So the one message, and Carl and I were talking about this a little bit earlier, the one message that from the FTA down that we are really hearing about and that we want to push out is, if you are a transit agency, you need to have a plan for how you're going to spend that you got through either CARES, HIRTA, or the American Rescue Plan. It's incredibly important because, again, Congress is saying, and they're asking the FTA, we gave you all this money, but there's still all this money left on the table. Why are people not using it? And what they don't understand is that the local share is probably, again, pretty shaky going forward. We know local governments and state governments, their revenues have really dropped. So our belief is that transit agencies are being frugal. They're planning for the future, but Congress doesn't see it that way. And we need to make sure. So one of the things that CTIA is really going to be pushing is, and perhaps even creating a template for, is to ask transit agencies to create a spend down plan so they can share that with the FTA. And so they have something to take to Congress and say, we know we're not spending this money down as fast as you would like, but that's because we are planning for the future. So funding, a different type of funding challenge. It's got a huge opportunity against $70 billion. And of course, now we have earmarks in the mix as well. But how are we going to spend all this down, and how are we going to show Congress that we're spending the money wisely? Another opportunity, those different kinds of buses. One of the provisions that right now is in the reauthorization legislation, which we are working very hard to make sure it doesn't stay in the legislation, is a perceived change to CDL licensing. Right now, you need a CDL to drive past 16 and above passengers. There is, and we still can't quite figure out how it got into the bill, there is something that is saying that you need a CDL if you're driving 8 or more passengers. We know this will have a huge impact on human service agencies, on volunteer driver programs, some who might be using larger vehicles rather than just sedans, and also public transit agencies. So Jeremy is talking about how do you want to redesign your service? And so on one hand, we're hearing so much more about microtransit. There are programs talking about having, like the Flint, Michigan program, Rides to Wellness. They're providing trips under the transit agency with sedans. But so there's all of this kind of what we call right sizing your vehicle. Yet if we get the CDL thing, if it stays within reauthorization, that's really going to kind of curb where we can get our workforce and how we can go forward in implementing those new kinds of transportation. So again, an opportunity to kind of rethink, as Jeremy mentioned, your type of service, but on the other hand, you've got CDL thing coming through in reauthorization. So it's just, again, something to think about. And again, that perception of public transit, there is an opportunity to frame yourself. Always transit is not an end in itself. Transit is always to a destination. And again, during COVID, we saw a much closer link to what transit can do to support people and what we call social determinants of health destinations, going to the grocery store, going and getting your meds, social activities, going to training, all of those type activities. So we really need to continue to cement the perception of public transit as this community partner, and not just as the bus that runs up and down the road for those people. Okay, next slide, please. So we see some opening. One of the things I wanted just to mention very quickly is you are probably aware that on the last day of 2020, Congress passed the Consolidation Budget Act. And within that act, it codified the non-emergency medical transportation benefit. That means that states can no longer just request a waiver from CMS to not provide transportation for Medicaid patients and have it be allowed. Instead, now it is now codified in law. So what the opportunity is here is that CMS within that same legislation has been tasked with pulling together stakeholder groups to talk about how the benefit, what are the challenges to implementing the benefit, and then they need to report back to Congress. There also is a clause in that legislation requiring coordination between CMS or Medicaid services, I should say state Medicaid services, and other services. And for the first time too, there are requirements for standards that transit agencies meet every day in terms of drug and alcohol testing, et cetera, that now NEMT providers are going to have to meet. So we're getting a little bit more of a playing field here. In addition to that, that coordination piece is going to, we hope, it's going to help us get our foot in the door in terms of improving our coordination with CMS and with Medicaid patients. Another door that's opening again, as I mentioned, is the reauthorization and the earmarks. The earmarks, there are two sets of earmarks. There are going to be small earmarks in the appropriations bills, but also within the reauthorization, they will allow larger earmarks that are spread over 5 years of the Reauthorization Act. So this is a time to think about projects, large projects that you would like to happen and started put together, get your ducks in a row to kind of sharing that with your congressional representative. Another door that's opening is the new administration's priorities, which are a change from the last administration. And I wanted to leave these three vowel words with you: environment, equity, and infrastructure. In your grants, you will be more successful if you, at least if they're going up and they're receiving federal funding, if you show the benefit to the environment of your project, if you show how it achieves equity, and then also if you can show that you are helping to support infrastructure, or that you're tying into the infrastructure that's being built. Those are the priorities, especially that infrastructure has a lot of opportunity for us. I mean, we know buses run up and down roads, they run up and down bridges, all very important infrastructure for them, but even more so is broader definition of infrastructure in terms of Wi-Fi and broadband. We know that through broadband and tech apps, that's one of the ways that we can improve people's access to transportation. And if that broadband indeed sticks within the infrastructure bill once it goes through the congressional process, that will really benefit our agencies. And again, those new best friends forever. So you new BFF. Okay, I'm going to go through the next couple slides very, very fast. Just to wrap up, just remind everybody that finally in person, yes, CTIA will be holding its 2021 Expo. We'll be in Richmond, Virginia. We hope to see you there. And the next slide, please. I wanted to also remind you of CTA's Emerging Leaders Academy. We created this academy to help with succession planning. So if you have individuals in your transit agency who, or even within a human service agency that provides transportation, and who you would really like to give them that bump up so that they are ready to step up into leader's shoes, this could very well be an opportunity for them. So keep an eye on that. Next slide, please. In terms of other in-person events, NCM is switching out NCMM. We will be issuing a recall for letters of interest for, again, what we hope to be in-person regional mobility summits. And those will be for communities who pull together multi-sector partners and focus on a specific issue they really want to work on. And we will come out for a full day and facilitate that workshop for you. And finally, there is the, oh, I'm sorry, go back one more. I shouldn't have said finally, that was the Q word. We do have our mobility management forum. And again, you do not have to have the title mobility management. You do not have to be working in a transit agency to attend. If you are someone in a human service agency or a workforce agency, and you have on your plate helping the people you serve get the transportation they need, we would love to have you come join us for our mobility management forum. Will be wrapped in with Expo. Okay, now you can go to the next slide. Just some really quick resources you might be interested in. At NCMM on our website, we daily gather news on transportation, and this is very broad transportation as it relates to healthcare access, job access, people with disability, new technologies like autonomous vehicles, microtransit, micromobility, everything. And it's fully searchable. You can just put your keyword in, and if you're trying to find out what communities are doing in terms of, let's say, microtransit, you can plug in that term and search, and you will pull up the daily news article. We also have creating a searchable database of community transportation systems, and you'll hear more of that. And Carl will probably be tapping into you to help us do that. We are going to put together a comprehensive database of all these different types of transportation services. Again, this kind of grew out of the fact that the FDA had asked us to partner with many non-transportation agencies. And one of the first questions was, well, who's providing transportation in my community? So this is going to be a one-stop place where people can find everything. So again, Carl will be knocking on your door, so you can kind of help us that with the Iowa agencies. And again, we're also going to be creating a searchable database of promising practices that will come forward. So again, if you're looking for who someone else in the country is doing a really good job in contracts with hospitals to help with discharge rides, for example, you'll be able to find that. And finally, there's our blog, Mobility Lines. We have about 2 issues a week and some really pretty interesting topics. So I encourage you to take a look at that. And I think that's it, I believe. Oh, no, one more. Grants coming up. We have grants as well. We have 3 phases of grants coming out, well, March 21. We're still waiting on FTA's final approval, so it'll be now April 21. We'll have planning grants to take people through a human-centered design process for another $25,000 grant. And those who are successful follow on to what we call our proof of concept grants or learning launch grants for $20,000. And then there's an open application process for our pilot grants for $75,000. So that, I believe, is it. I think the last slide just has my contact information, and happy to turn to the panel discussion and the questions that you might have.
So yeah, we have some time for some questions. If anybody else does have questions, go ahead and put them in the chat. Otherwise, I'll go ahead and start. I'll just go ahead and ask a question, and anybody who wants to take it can go ahead. So question number 1, what examples have you heard of in Iowa across the country of partnerships that hadn't existed before COVID? I have a lot to share, but Carl, I don't know if you want to share some first from Iowa that you've heard of? Or
dealing with COVID, the partnerships we are seeing is a lot with our food banks, facility centers, distribution centers. I think people are realizing, especially for our essential services, that employers are really starting to come out and really rethink about doing workforce rides, making sure their public transit is part of that strategy. And oh my gosh, I just had one more and now I lost it here, so I apologize. But what we're also seeing with some of these are just unique certain systems. So you look at when you think about starting Iowa and then how does it affect nationally, think about immigrant populations. We're trying to work on programs here dealing with individuals, inmates, as they just get released. How's that? How do they get to the next service, so forth. While some of that has been necessarily started or right around the pandemic, they have just exacerbated the necessity of having those services. And those are a couple that I could see really growing on a national scale in different forms.
Okay. I'll also kind of chime in. So actually the FTA asked us back in, I don't remember when it was, earlier last year, I think it was, to start creating a rolling table on our website of what they're calling incidental use. So this was when transit buses were not being used to transport people. So the FAA made clear that as long as that there could be what they called incidental uses of transit. And in fact, apparently incidental use has always been allowed as long as it doesn't interfere with transit services. So some of the partnerships, to add on to what Carl said, we've definitely seen a ton of examples around getting people to vaccination clinics. We've had a couple places, like there's one in Texas I can think of, where they actually used their new mobility center as a vaccine clinic in rural Texas, because there just weren't many buildings out in this rural that were large enough to kind of allow the distancing and allow them to set up clinics. We've seen partnerships with public health departments. I think that's one that for most transit providers. There's one in Washington State where they contract with the health department to take requests for vaccinations. And then when then the health department kind of gives them certain vaccination slots. And when they are available, not only does the transit agency call people back and say, hey, I've got a vaccine appointment for you, but we'll get you there as well. We've seen partnerships with homeless agencies trying to assist bringing individuals to temporary hotel or motel accommodation, because they didn't want them to be mixing in the congregate sites. We certainly have a ton of examples of not only just the food banks that Carl mentioned, but the where transit agencies are actually picking up groceries for people, where they were picking up meds and delivering those. So all of these are new, or not all of these are new, but I mean, a lot of them are newer. We also saw some partnering with school systems, where the school system and the housing agencies got together and requested that the buses park outside with the public housing so that the children inside had access to Wi-Fi. They access their classes. So we're seeing all sorts of interesting examples. And this is what I call these our BFFs. We have shown that we're willing partners. We'll roll up our sleeves, do what it takes. And we have got to continue to capitalize on those examples. One last thing in terms of I'm working with law enforcement is there's a big push to have transit agents learn more to begin to recognize what sex trafficking might look like in their and how they could recognize that, and how if they see suspect as being trafficked, how they can refer them to the police, for some support. So there's all sorts of different partnerships.
Okay. Jeremy, this one might be best suited for you. Do you think COVID has impacted the way we will be doing community involvement moving forward? And how can we kind of work on being inclusive in our community involvement, especially in rural areas?
I really do think so. However, I keep holding on to the fact that humans thrive on other personal interactions and that one-on-one attention. I think, when I think about, gaining that confidence of the rider back, I don't think that's gone away. People still want to get where they need to go, and there are people that need to go where they need to go. So I think those people will come back, but I think it's a matter of time. So I think we'll be operating in this hybrid model. I think maybe a lot of our meetings will have to include a Zoom link, or have to include other ways of reaching out. Like you said, in those rural communities, thinking about just how you can reach the people where they are. Is there local radio stations that you can broadcast your message? Is there ways to get mailings out to people where they live? Is there a way to talk to someone when they're scheduling their ride? Is there a way to interact with them that way? I mentioned that we've started or doing lunch and learns or virtual office hours, having sort of a targeted idea of talking to our writers and interacting with them that way to learn more about what we're doing. So I think there are some ways that we can continue this virtual world, but I think over time, I think we will definitely get back to where where we were. But I do believe that there will be a lot of hesitancy probably for a little bit. But I feel like people are needing that interaction, that personal touch, if you want to say.
Great. Carl, this one's probably for you. What ways can we work together to educate our local and state leaders on inclusion?
We actually have been talking a lot about that as we're right now in the state legislature for Iowa, but we're also approaching our reauthorization appropriations at the federal level. Quite honestly, we always state that the best thing you can do is invite them for a cup of coffee. I know that's a little challenging here with COVID, Zooming, but we find the best work being done is over the summer and the fall prior to that legislative session if you're working on it. And you'd be amazed at your legislators. Sometimes it's intimidating, but if you make that an invitation to want to have that discussion, talk about community concerns, maybe even have some of your stakeholders and partners there as well. They are always usually willing to have a discussion, a meeting, and we've done that throughout the summer here and just kind of did some coffees one-on-one. Everyone made it. We asked for half an hour, 45 minutes. Each of them gave us 2 hours to really discuss some of those things. So start thinking about the off time in the legislative session to start prepping for that and have an honest conversation with it. Bring some examples. They'll ask for some stats as well, if you possibly have that. And then if there's a specific ask, make that very clear of what it is, how they can help. Because if it's something very finite, they will work on it. They will work with their legislative staff, their caucus staff to try to bring something to light. And so, like I said, if you think about doing that over a legislative session, you're already too late. The time is going to be here in May, June, and July to start talking with your legislators on that. And I'll be quite honest, with COVID going on, email is noise now, which it still works, don't get me wrong, but the old-fashioned writing a letter and doing the mail-ins, those are starting to get noticed, believe it or not, where people are actually picking them up, opening the letter, may still throw it away, might file it, but at the end of the day, they're actually separating from the noise. So we're actually finding the old school tricks of trying to make legislators aware that way.
Great.
Can I jump in here, Danny, as well?
Absolutely.
Okay. So the other thing I wanted to kind of piggyback on what Carl has said is the conversation, the thoughts that I've had for quite a long time is that rural areas, it's much more difficult for them to show their value in the traditional ways. Many times funders look at, well, how many people did you put on your bus? How many rides did you provide? And we're not winning the conversation of, I could have 5 people on my vehicle, but those 5 people, that trip is life sustaining. And so we're doing that argument, and we're not making the strong enough argument about those quality of life trips versus just straight up numbers. And we need to do that stronger. The other thing is kind of related to that is we haven't, and recognize this at CTIA as well, we haven't done a great job of succinctly showing the impact of transportation on people's lives. So I just wanted to add that in there.
Great. Yeah, thanks for adding that. What role does diversity, equity, and inclusion play in driver recruitment and retention? You know, whether that's thinking about like your community needs or what have you.
That's a tough one. I would say that's actually trumped by. Say again?
I might just start that. Just here in rural Iowa, you really think about it, quite honestly, we are seeing, because of the pandemic, COVID, that individuals who might be retired might look at this as that kind of the second career, part-time, where they're not going out and getting these jobs. And so we're seeing a driver shortage across the whole state of Iowa, and we've had some systems raise their hourly rates quite a bit. And it's not just us, it's also the school districts having the same issues. So when you talk about inclusiveness, quite honestly, I think our systems are, maybe have to relook at how they are engineering, how they're looking for these drivers, so forth. But quite honestly, there's such a shortage. They are looking for anyone. Quite honestly, I mean, it's a big struggle. And FTA asks, what's your struggle? I mean, funding is one thing, but even just having the personnel to go out, especially we're still in a pandemic, to do that. And quite honestly, you're probably transporting maybe individuals to COVID clinics. That's a big challenge. And so just to even start on it, unemployment's low. It's a big issue. So just kind of set that line, and then you add on to that. It's a challenging question. I don't know, Amy, if you have a little more to add on that or not.
I was going to give the exact same answer you did, that at this point, people are just crying out for drivers. It's across the country. It's not just in Iowa, that's the country. And one of the things, just going back to that CDL argument in a different way, that is one of the things we're hearing is that if as a benefit, the transit agency is willing to pay for a driver to get a CDL, then trucking companies come and pay them more and take them off. So it is very tough. So, it's national. It's just tough. And I don't have an answer.
If I could, I know one of the DART team members just recently stated that they started, and this is Des Moines DART for those guys don't know, but started a diversity, equity, inclusion committee to help make sure that the operators and the team feel as though everyone is welcome, respected, and also have a safe space to work. So don't even think about the individuals trying to recruit, but also then for your retention aspects. I think that's a terrific idea.
Yeah, for sure. What are you guys hearing about transit agencies about the bounce back and ridership numbers?
I'll start just at a kind of local and statewide level, but we still, when you talk to a lot of our systems, some are really going, but most of them are still seeing, I would still say, still maybe at 75% capacity. Very few are back at that 100%, at least from the light polling we've kind of been doing overall.
I think there's been just a little bit of bounce back for those truly essential trips, those working at grocery stores or hotels or whatnot. So those kind of localized trips. But then, in those larger urban areas, you're probably not seeing a good bounce back for those commuters. The commuters that are maybe living out in the suburbs and coming into work downtown. I highly doubt that those are bouncing back. And, I'm not even hearing of businesses that are going back full time yet. As Amy even mentioned, even her organization, they're thinking about doing something. So I think that might be a slower bounce back, those commuter type work trips.
All right. Then the last question here, what does future funding look like for transit? Just moving forward.
Well, I think I touched on some of that in my slides. It's hard to know what direction Congress is going to go in. I mean, they've opened the purse so wide for the last year, and it's hard to know what's going to happen with reauthorization. We do know that in terms of reauthorization House bill, the Invest Act, which is what was passed by the House last year, that's their starting point. And there is a lot good in there. There are definitely higher levels of funding for the formula programs across that. So it seems like at the congressional level, at least at our starting point with the House bill, funding looks good. I think where we're going to be struggling again is that local share, because governments just don't have the revenue that they had from taxes, et cetera. So that's going to be where there's going to be required an awful lot more creativity on the part of agencies finding that local share. So, Carl, I don't know, or Jeremy, if you have thoughts on that.
For us, where our concern is with the funding, and I believe Scott Bogren, CTA, has highlighted this multiple times. There's going to be a little bit of buyer's remorse with as much funding as going into transit, where I feel like that's going to actually hurt us, not today, but in maybe the next reauthorization, or quite honestly, just in the next few years. But what's so interesting is the administration is really focused on, and I know Amy has highlighted this, really focused on, really clean energy vehicles. So right sizing, but also in electric vehicles. And so what's unique is we have some of the first electric buses here with Des Moines Dart, but we also have an application that'll be going in to have rural systems apply for some of those electric vehicles. And meeting with the FTA administrator, that was really kind of her signal of, that's where I want systems to be going. I want us to rebuild our infrastructure and to really focus on electric vehicles. And so will we have the money for that? Will that continue to be invested in? That has to be our kind of story that we keep hounding. And as Amy indicated, we keep telling a better story, why that's so critical, especially in Washington.
And I think, Carl, you're right. I think the environmental piece may save us from that buyer's remorse, because that is a big piece of transit. I read an article recently that I just want to share. It's just kind of intrigues me in terms of battery buses, electric buses. And there's, I was reading about some examples of, so for in a rural area, keeping buses charged has got to be challenging when you're going long distances, because those buses only hold, and Carl, you would know a lot better than I would, so much of a charge. But there's more and more technology being developed and it's actually using to swap out batteries. So rather than waiting and recharging a battery, you just swap out the battery for a new one. And it's something that seems to be targeted for systems like with fleets, like transit agencies have, that are frequently using. That might be a really interesting earmark project to ask for, to see. Volkswagen has it. We know Tesla has it. There are a number of other manufacturers that now are working on that technology. So capital projects like that again, like I said, work on either equity, so it helps you serve areas that are underserved, or helps you kind of address environmental issues. That may, like I said, may save us from any kind of lashback for the high funding that has been received so far.
All right, and then one last tip here from Julie in the chat. Make your EEO statement more than just the standard required wording, so that people know that you actually care and thought about inclusion/diversity. And here's HIRTA's. As an equal opportunity employer, HIRTA values diversity and strives to expand representation at all levels in our workforce. So I just wanted to thank the panel for joining us today, and hope everybody learned some things and took away some things to, practices to use at their own company.
Thank you very much.
Absolutely.
Thank you so much. Appreciate it.
Thank each of you. It's good to see your faces.
See you, Julia. Hope we see you in Richmond.
I'm registered.
Fantastic. And Carl, you too, and Jeremy. Bye-bye.
Bye.